Thomas Burwinkle has been a fertility doctor for decades and says he has seen a steady increase in patients over the years, but that didn't come easily. He says just the thought of IVF alone was so taboo, let alone the stigma that can come along with seeing a fertility doctor. These days, so IVF treatment is much more common and is becoming a more accepted practice for people to expand their families. But recently, he has seen the concern of some, including those in his office, over the future of IVF treatment.
If one of our lab personnel drops a culture dish that has embryos in it, are they going to be convicted of manslaughter?
Last week's ruling in Alabama causing concern for those who work in IVF and patients who are considering treatment to help expand their families. Various Kentucky lawmakers recently introducing bills to help protect IVF treatment.
Well, IVF is a way for couples to conceive by artificial means. And typically what it involves is taking fertility medications to have the woman produce extra eggs. Then those are collected and fertilized with partner sperm, and we grow the embryos up.
The Alabama Supreme Court ruling embryos are considered children. Fertility doctor Thomas Burwinkle has been practicing for decades, a profession he says was not as popular, but rather was seen as taboo.
After an egg gets fertilized, then the cells divide, and they go and continuously divide for several days. And they can grow up to about 120 to 150 cells during that period of time. At that point of development, we call it a blastocyst. It either has to implant into the woman's uterus or it has to be frozen. If you don't do anything with it, then it will try to attach to the culture dish. And since it doesn't have any support, it will die at that point. But there's no heartbeat, there's no head, there's no body, there are no arms or legs or fingers.
Dr. Burwinkle believes calling an embryo an unborn child and giving it the same legal rights creates issues with what he does as a physician.
I've already heard medical students, I've heard residents that are looking at going to other states to practice medicine in other states that are more favorable to doing IVF or other women's reproductive rights issues.
He also sends a message to those who see it as a positive, the actions in Alabama.
Let's work together to make the best decisions for the patient. Let's keep politicians out of these conversations. And that's the biggest thing. I'm not there trying to tell them how to do their jobs. I hope they can let us do our jobs.
Another bill also introduced in Kentucky was House Bill 757 that would also protect IVF, but also declared that a fertilized human egg or embryo outside of the uterus would not be considered an unborn child. We'll keep you updated on these bills here on ABC 36. For now, I'm Anna Medina.